y'all, it's Dr. Tiffany. I hope you're doing well. And with me as always is Audrey, the non-doom kitty. We're going to need her for this one. So this is a update on the measles situation. It's getting out of control fast. First things first. This behind me is a list of most of the states where cases are found and the counties they're found in. So if you want at any time, you can come back to this, pause, take a screenshot, and zoom in if you can't read it. But I'm going to get out of the way so you have a chance to do that, okay? Because also on this list, also that needs to be on this list is Louisiana, and we'll get to that in a second. So, but yeah, this way you can refer back to this. Next, I'm going to also have a video out, hopefully later today, that has the symptoms of measles that I'm going to pin to the top of my page. Why? Because this is escalating quickly and it's nowhere near under control. And random cases are appearing in random places, and that is not a good thing. Arizona now has 3 cases since I made my last video. 2 of them are new, and they are in Maricopa County in Phoenix. And the story on it that I will show in my next slide. Hold on, let me bring that up. These are some of the sources that I used in there, so if you wanted to verify what I say, there's that. But the story itself, I don't have room to list all the stories in entirety, but it has lists of places that people were exposed at. Some of these other places do too. So if you are from these areas and you wanted to know if you're at risk, that is a resource for you, okay? I will be bringing more on that as the story develops and new cases are found as well. In New Orleans, 2 cases. This represents a new state and area of infection. 2 cases came to light yesterday. They're in the greater New Orleans area. I don't know much more about that, but I did put the Louisiana Health Department statement up on there. Florida is still at 6. The scary thing about the Florida outbreak is there's no travel history with any of those people, period. There's other outbreaks that don't have travel histories, but Florida is significant because they don't have travel history, and their Surgeon General issued the statement, their statement issued doesn't even recommend unvaccinated kids get vaccinated, and furthermore recommends that they be sent to school even if the school has cases. I put that article from the Washington Post up here, just so people can verify that. That is a ridiculous public health disgrace. That is just my opinion, but I think my opinion is fairly valid here. So that brings us to over 30 cases in the United States in 14 different states. So this is getting out of control. Think of how many unfound cases there are in, number 1, possibly in different states, because see, the rash doesn't even appear until day 3 or day 4. And number 2, even if the rash does appear, if it's with some people, they may not even bring their kid to medical attention, because you have things like Surgeon General saying that it's no big deal, you know. And across the pond in the United Kingdom, they updated to now over 169 cases, mostly in the Birmingham area there in the United Kingdom, and 65% of those are under 10 years old. I wasn't able to find demographic information here, and there isn't like a good board for tracking here, so I'm having to do basically 1 or 2 hour in-depth searches to find this information. So, but I'm gonna start making regular updates on this situation until it dies down, because I think that this is a serious public health threat. I love you. Stay safe.